Hello and welcome to Chairside Live. I'm your host, Megan Strong. Thanks for tuning in today. Today's show is all about BioTemps Provisionals. Our registered dental assistant, Will Schmidt, is using a plastic stent to help place a single unit in the anterior. Glidewell provides a stent in every BioTemps case we send out. So Will is going to walk us through his tips for using the stent when seating BioTemps in the aesthetic zone. He's maximizing the effectiveness of his acrylic reline and the final aesthetic result. Without much further ado, here's Will.
Thank you, Megan. Today I'd like to show a simple yet highly effective trick that I like to use when placing single-unit BioTemps, especially those in the aesthetic area that you absolutely want your patients to appreciate and not feel anxiety about when smiling or talking. BioTemps are precisely milled over virtually prepped models here at Glidewell Labs. However, even the most ideal virtual prep design may not match the actual preparation exactly due to many variables. In this example, we can see that after removing the patient's existing crown, the final preparation was much different than our BioTemps. Upon try-in, you can see that the incisal edges don't comfortably line up and the gingival third of the BioTemp impedes the tissue and causes pressure to be applied. In these situations, I prefer to use a plastic stent to aid the seating of the BioTemp and ensure that the incisal edge, path of insertion, and occlusal plane line up. When sending your patient's preliminary impression to the lab for fabrication, note on the lab slip that a plastic stent is requested to accompany the case. You also have the option of fabricating your own stent in office over the virtually prepared model and BioTemp, similar to the way a bleaching tray would be made. Try in your plastic stent to double check that it fits over the prepared tooth and then try in once again with the BioTemp in place. Practice insertion so that one attempt is all you need to line the temporary into place. To avoid undercuts and overflow of flash acrylic reline material, if needed, place a bit of light cure blockout resin in the undercut areas that can direct the acrylic flow away from locking the BioTemp into place. Other blockout materials such as wax or strips of Teflon tape may also be used in place of resins. As you can see from this lingual view, I have blocked out undercuts to my satisfaction without hindering the BioTemp placement. With the BioTemp snugly in place inside the plastic stent, extrude the acrylic reline from bottom to top, keeping the mixing tip buried in the material to prevent air bubbles from forming. Place the entire assembly over the preparation and seat in a slow, controlled manner until the incisal edges line up. Upon hardening of the reline, remove the stent and double-check that the BioTemp has seated properly. Apply gentle force to loosen the BioTemp and begin to remove the excess flash acrylic overflow as it starts to separate. As the BioTemp starts to drop, punch through any blockout resin that may have also temporarily adhered itself to the reline. I give the BioTemp a quick inspection for discrepancies or tears in the reline and then immediately focus on the removal of additional flash and blockout that remains in the patient's mouth. I can now continue to remove flash and reshape this BioTemp chairside. Starting with a coarse diamond burr, I remove the excess bulk acrylic and soften the margins. Moving to a finer diamond burr, I then refine and shape the margins and profile to help train the gingiva to seat well against the eventual final restoration. Dry seating the BioTemp in the mouth to check the shape and contact areas is critical before ensuring the occlusion is within proper limits. I ask the patient to not only bite up and down on the occlusal marking paper, but to also slide back and forth in normal chewing motions. Additional occlusal adjustments can be performed chairside if necessary. After all adjustments have been made, I apply a thin layer of glaze such as Fuji coat or even a bit of additional bonding agent if that was used during the day's procedure to fill in the adjusted, polished areas and give the BioTemp a realistic, wet look. My temporary cement of choice when seating aesthetic anterior temporaries, whether multi-unit veneers or single-unit crowns, is Temp Bond Clear. This compound does not change the shade of the BioTemp and is easy to clean once hardened, as well as when the BioTemp is eventually removed for final try-in and seat of a permanent restoration. Pay extra attention when using clear cements to make sure that all the film is removed from the neighboring teeth, contact areas, and margins. For our final smile clip to show off the freshly placed BioTemp, I'm adjusting the patient's lips slightly because she is still a bit numb and stretched out from wearing a retracting device. This BioTemp has a nice incisal edge anatomy to match the adjacent tooth, the length and profile are acceptable, and even a natural incisal halo effect is present. I have found this to be an easy and fail-safe method of directing the path of insertion and lining incisal edges of virtually prepared BioTemps in highly aesthetic zones. This continues to produce results that are desirable to patient and practitioner alike. Doctors and staff, thank you for tuning in to another episode of Across the Chair. Right back to you, Megan.
Thank you for that, Will. Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glidewell Laboratories, thank you for watching, and I'll meet you right back here next time.